Welcome back to Now Media's TV show, Pain Diaries, broadcasting here in Houston, Texas. We are back with Kathleen Bomersbach, one of our patients here in Houston. She's had incredible success with our comprehensive approach at Performance Pain and Sports Medicine. Welcome back.
Hi, I'm glad to be back.
So can you share your journey?
Sure.
The reasons that led you to consider hormone replacement therapy?
Absolutely. I was already an existing patient of Dr. Manzi's and Dr. Wiederholt's. They helped me with a traumatic spinal cord injury that I sustained. But I also started reading some information that they had available out in the lobby. And I'm like, I've heard really good stuff about this, but I'm going to dig a little bit more. And I discussed BHRT, bioidentical hormone replacement therapy, and then also discussed some peptide therapies that I was interested in, and wanted their guidance on it to see if they thought that it could help me out and get me to where I wanted to be, and maybe help me level up a little in life.
Yeah, it's all about getting the edge, right? And
yes.
making yourself feel better.
Absolutely.
So let's first talk about hormones and how the replacement have actually given you part of your life back, besides the pain therapies we've done, which have really helped significantly. What has hormone therapy done for you?
So far, the hormone therapy, I started noticing a difference immediately. I know that generally you have to build up to it to where you actually start feeling real benefits from the medication. I noticed it right away. I had energy. I do more. I'm able to push further in my workouts with my trainer, which makes my trainer happy. And my mood was more stabilized. I'm past menopause, but it's still, I was still suffering a little bit with my moods being up and some days down. But it really helped level me out, helped me feel more like me again, because I feel like I was kind of lost there for a few years, didn't really feel settled into myself. And I really think that the BHRT implants really brought me back into feeling more like Kathleen again instead of this alien that had taken over my body that I didn't like very much.
Right, so you have the testosterone and the estradiol
yes.
as a pellet implant,
yes.
and then you're taking oral, a few medicines as well.
Yes, I am. I'm taking progesterone as well.
Progesterone at night, and then thyroid
and
in the morning?
I do thyroid in the morning, and then I take DIM to lower the estrogen levels so that it's nice and even through the day.
Yes, absolutely. And so the hormone replacement, you said you were having some mood swings and fogginess and just not
yes.
having that energy. And I mean, immediate results is pretty amazing.
Exactly. It was wonderful too because, like I said, it was almost like there was a different person walking around in my skin for a while, and didn't feel like me. Didn't have my personality, my quirks and idiosyncrasies were kind of even lost. So I'm glad to be back.
Absolutely. And adding the nutraceuticals onto that, like you mentioned, DIM.
Yes.
I mean, it helps kind of take those hormones to the next level and really allow them to work better.
Right.
So you have less side effects and a better outcome.
Right.
So then
they're optimized
exactly.
at this point, yes.
Exactly. And so with the optimization, you still have issues with your autoimmune disorder.
Correct.
And some sleep issues. So, and then when I first met you, you were struggling. You were depressed, you were overweight, you didn't feel good, you were just one big ball of inflammation.
Yes.
And we've definitely changed that over the years now. And I mean, we've been together like 10 years.
Yes, exactly.
Doctor relationship. And I remember looking at your picture because we hadn't gotten a new one, and you were a totally different person in your picture on your ID in our charts.
Yes.
And now I was like, wait, is that you? You have the same voice, but you look completely different because we also worked on your weight loss.
Right. People who saw me right after my traumatic spinal cord injury, and even in the few years where I was bedridden, the few times I was able to get out of the house or I'd be around friends at church, you could almost tell by the shock on their face, wow, what happened to you? Yes, I recognize you had something, traumatic happen to your body, but I literally did not look like me. I didn't function like me. It was a mess. So we had to go back and rebuild.
And here we are now. So we prescribed you 3 different peptides. One of
Yes.
them for your autoimmune disease, one for sleep, and one for weight loss. And you've just started these,
Yes.
what, 6 weeks ago or so,
Yeah.
maybe even a month, and you've already felt a difference.
I sure have. Let me talk about the one for autoimmune, the one that helps with for anti-inflammatory benefits, which addresses my autoimmune disorders. I have 5 autoimmune disorders.
Wow.
I've actually was able to put those into remission med-free, so I don't take any of the cancer-causing drugs that are prescribed often by rheumatologists. You know, and yes, they're necessary for some people. I'm not discouraging you from taking what your doctor prescribes. However, I went a different path. I wanted to get to root causes and heal and lessen the inflammation that was going on in my body. So I had to start with nutrition. That was the basis of it. But adding the peptides on along with it, normally I have to maintain so strict to my anti-inflammatory diet. I can't let myself have sugars or dairy or anything that's going to, corn, anything that will throw me into a flare or throw my body off into a state of inflammation. And the peptides I've noticed already, and I've only been taking them a few weeks, even on days where I've had a cheat meal or, you know, didn't eat pristinely like I hoped to eat, I did not at all get any inflammation, no swelling. My hands still opened like they're supposed to. Whereas before, my hands were like almost in a C because I had so much inflammation and swelling in my joints. Because, like I said, I have 5 autoimmune disorders, which means my body's attacking itself. So keeping your state of inflammation low is key. And the peptide therapy has literally just helped me level up my game on keeping the inflammatory response from happening and triggering within my body. And it's been wonderful to live with.
No, I mean, the combination, the hormones, the peptides, and the nutraceuticals on top of it, they're really letting you achieve your health and wellness goals now because you've been through so much.
Yes.
And, you know, just anything that gives you that edge, I mean, you're there now.
Absolutely. And to go on with the other peptide therapy that I take that's for sleep, because of my traumatic spinal cord injury, yes, I have implanted devices, but I do still struggle with some pain, residual pain. We did a little tweaking today on my pain pump, so I think that'll help resolve it. But I still will have moments of pain. It doesn't completely wipe it out, but I do have a high pain tolerance. But sometimes at night, my brain won't stop thinking. My body may not stop aching, and I will have a hard time falling asleep and staying asleep. Staying asleep was one of the bigger factors of it. And I've only been on the sleep peptide therapy. That's the DISP.
DSIP, Delta Sleep-Inducing Peptide.
That's it. I always want to put it the other way, DISP. Okay. But anyways, but that has literally already, I can fall, I'm not falling asleep at my ideal time yet, but I know I'm going to get there. But I'm staying asleep all night long. I have not had any, no pain has been waking me up, which has always been a problem. I have to sleep in certain positions, surrounded by pillows to support my body. But and now I'm getting 8 solid hours of sleep, and it's like bizarre because it's been a decade since I've been able to do that.
And the health benefits with just sleep alone are,
sleep.
You know, we can't
that's
even
when our body
quantify it.
heals.
Yes, that's when we heal.
That's when our body heals, and
Exactly.
it's necessary to sleep. I mean, going without sleep can kill us. You know, so it's really important, and for me to have uninterrupted sleep.
For sure.
This is just such a deal. It's just amazing how it's improved for me.
Fantastic.
Yes.
So, I mean, we've just kind of broken through another boundary with you, and
Yes.
I feel like we have so many more long-term benefits of this comprehensive treatment that we're going to help you with protecting your bones from fractures
Yes.
and keeping your pain managed and your inflammation managed. And, you know, you've lost how much weight now?
110 pounds.
Whoa! I mean, unbelievable.
I wasn't super big before my traumatic spinal cord injury. I was overweight. I was overweight for several years, but I gained a lot of weight when I was bedridden. Literally couldn't exercise.
Yeah.
I would use little resistance bands just on my arms in bed, but that was literally the extent to what I could exercise. Other than my mouth, you know. So I exercised the mouth a lot with eating, yes, and grew and grew and grew, and didn't look like myself, didn't feel like myself, and it's hard to regain your health and work towards a health goal when you're round, and so that just helping me slim, me getting my nutrition dialed in. And then now with the benefit of the peptide therapies, it's just been amazing. I feel like, I'm 53 right now. I feel like I'm in good hands going forward to where I'm going to be the healthiest 90-year-old that I know.
For sure. So
despite everything.
I'm so grateful that you've bought into what we've are able to provide for people, and look at the results. I mean, it's astounding.
Yes.
So thank you so much for sharing your story. And as you know, Pain Diaries is here to help people understand the options available for treatment. So thank you for being here.
Absolutely. Happy to help.
Well, Dr. Manzi here. If you or a loved one wants to be evaluated, please know there are options. Find your nearest expert in the field to see if you are a candidate for hormone replacement, peptide therapy, and nutraceuticals, which can really change lives for the better. Remember, find us at Performance Pain and Sports Medicine, where we help you live your best life. Dr. Manzi here, and this is Pain Diaries. Take care of you so you can take care of business.